Hi everyone, welcome to JOANTalks, and I'm your host, Joan Liu. My goal for this podcast is to focus on putting together the knowledge and science relating to your health, fitness and nutrition that is easily understood and accessible by everyone. Without further delay, this is today's episode. Hi, welcome back to JOANTalks. So earlier we spoke about two pillars of fitness, one being the cardiovascular fitness and the other the strength pillar. So today we are going to talk about something that most would be familiar with or have heard, and that is the blood pressure. Indeed, it is an important subject. I was attending to 3 people over the recent weeks who came to see me to have their personal fitness program designed for them with the intention to improve their health status. Now, 2 out of the 3 has pre-existing health conditions, and that includes having high blood pressure readings. So I decided to talk about this, and in these 2 episodes, I will tell you what you need to know about blood pressure. What is high blood pressure? Why should we even care? What does it affect beyond heart disease? How do we measure it? What do you know about the variations in blood pressure through the day? And what do you do if your blood pressure numbers are high or even if it's low? And what can you do to lower high blood pressure? Now let's start with the risk factors for cardiovascular disease. Based on the World Health Organization guidelines, the primary behavioral risk factors of heart disease and stroke are basically unhealthy diet, physical inactivity, smoking, and harmful use of alcohol. So the effects of these behavioral risk factors may show up in individuals as raised blood pressure, raised blood glucose, increased blood lipids, overweight, and obesity. And these so-called intermediate risk factors can be measured in healthcare facilities, and any of these indicate an increased risk of heart attack, stroke, heart failure, and other complications. Now, I think most of you who are listening to this podcast, you would have your blood pressure measured at some point in your life, perhaps at a doctor's office, or maybe you measured it yourself. And in my case, I have done it for people who come and train with me. So what does the blood pressure measurement actually mean? First, we need to look at our own anatomy and understand what our heart is doing. Blood pressure simply refers to the force of blood pushing against the inner walls of your arteries. And this varies from person to person. Even for the same individual, the blood pressure may vary from time to time. For instance, if a person is angry versus when the same person is relaxed, it can be very different readings. So when your heart pumps, there is a pressure difference in the arteries as the heart contracts. So there are 2 phases, and we term this as a systole and the diastole. Now, first is the systole, and that is when the ventricles are contracting. Ventricles are the bigger chambers, and your blood is being pushed from the left ventricle, pumping blood against the systemic resistance of your whole body, and this works to deliver blood out and around your system. In this podcast, I will just be referring to this type of blood pressure. Now, there is another blood pressure in our body, which is the pulmonary blood pressure, and we won't be speaking about this today. The pulmonary blood pressure reflects the pressure the heart exerts to pump blood from the heart through the arteries of the lungs. In other words, it focuses on the pressure of the blood flow in your lungs, and this we will not talk about. So let's go back to the systole. Okay, when your blood leaves the heart through the aortic valve to the rest of the body, and this happens very quickly. So each of us will have a resting heart rate, and you can count that very easily by how many beats per minute. And there is a pressure in the artery that is experienced by literally the blood pushing against the walls of the artery during that phase. And this is a bigger number. Now there is another phase of the heart contraction which is equally important to know, and that's the diastole blood pressure, which is the relaxation of the ventricle after the heart squeezes. So after the blood leaves the heart has to relax to have the blood come back into the ventricles through the atria. And this is when the heart itself receives its blood supply, whereas all the other organs are receiving their blood supply during the systole phase. Even though the pressure in the arteries is lower during the diastole, there is still pressure within the artery walls. So when you are checking your blood pressure and you see two numbers, for example 125/79, it means when your heart pumps, there is a greater force as blood is leaving the left ventricle via the aorta, and the pressure is 125 millimeters of mercury. And when the ventricle relaxes and begins to fill through the left atrium, the pressure drops to 79 millimeters per mercury. Having high blood pressure is one of the top risk factors for heart attack and stroke, and it will be an advantage for anyone to know how to do it at home and check it yourself. So what are the categories of blood pressure and what will be defined as high in this context? Now, I've gotten data from the Singapore Heart Foundation, and based on the table given, the normal blood pressure reading would be anything that's less than 130/85, and at this stage, no treatment is required. So in a young, healthy person, normal blood pressure may vary from 90/60 to 120/80. For patients with type 2 diabetes or non-diabetic chronic kidney disease, an acceptable treatment target blood pressure is below 140/80. However, if you have diabetes or kidney disease, you must aim to keep your blood pressure within 120/80, as marginally higher blood pressure can increase your risk of developing other health problems. So from the table as well, given by the Singapore Heart Foundation, borderline high blood pressure readings will be defined as a reading of 130/85 to 139/89. And this is also considered as pre-hypertensive. If your blood pressure is higher than 130/85 most of the time, even at rest, it is a sign to start taking precautions and follow your doctor's advice to manage your blood pressure. Lifestyle changes will be strongly recommended. Next, if your systolic blood pressure is 140 or more, and or diastolic pressure is 90 or more, when measured on 2 or more occasions, you may be suffering from high blood pressure, and I do urge you to see your doctor as quick as possible. Now, please note that your blood pressure reading may vary depending on what you're doing, and that is what position you were in when you're measuring, how are you breathing, your emotional state, your exercise status, and of course, are you getting enough sleep? Okay, so that was the numbers given from the Singapore Heart Foundation. Now, in 2017, the American College of Cardiology and the American Heart Association, along with 9 other organizations, have released an updated blood pressure guidelines. And the key changes were made to the different tiers of blood pressure readings. Okay, so what are the changes? The new changes includes the emphasis on the importance of structured exercise in the prevention and treatment of hypertension. And it adjusted the category names and thresholds And it also lowered the definition of high blood pressure from 140 over 90 to 130 over 80. So hence, now the new normal for blood pressure would be both less systolically than 120 and diastolically 80. So hence, you need to be at or below 120 over 80 to be normal. Now, once the numbers hit above 120, and that is in between 121 to 129, but your diastolic remains at 80, this is now categorized as elevated blood pressure. So it's no longer normal, it is elevated. And then followed by 2 stages of hypertension. Stage 1 hypertension is now defined as a systolic blood pressure between 130 and 139, or diastolic pressure between 80 to 89. And this means that you could be 120 over 83, and now you are at stage 1 hypertension, even though the systolic is deemed as normal. Okay, so what does the stage 2 hypertension means? And that is when the systolic measurement exceeds 140 or the diastolic exceeds 90. So where do these changes come from in 2017? Why did they make a change? That is because there was a study done in 2015, and that is called the SPRINT trial. I will include the links and all the relevant reading materials in the description box on my YouTube channel. So for those of you who are keen to read out a little bit more, please go to my YouTube channel and download the studies from there. So the SPRINT trial in 2015, what it did was, the whole intention of the study was to understand what is the benefit of aggressive blood pressure control. The study looked at just under 10,000 people who had a systolic blood pressure of 130 or higher, who were also at advanced cardiovascular risk, but who did not have type 2 diabetes. Now, the reason why they selected this group of people is they needed a group who were at high risk for atherosclerotic cardiovascular disease, that you could start to see events in a relatively confined period of time. So the primary outcome was a reduction in cardiovascular mortality, and it was significant with a 25% relative reduction with an absolute risk difference of about 0.54% over the course of just 1 year. Now, some of you may think, that number doesn't sound like a lot. But we have to remember that this is only a single year of reduction in risk. And what can we take away from this? So even over a relatively short period of time, aggressive blood pressure management to a systolic pressure of less than 120, compared to what we used to think 130 to 140 is tolerable, it is clear in its importance of such recommendation. So let us consider why these things pose such a risk. For atherosclerotic cardiovascular disease, it is a disease of the heart and the blood vessels due to the accumulation of plaque. Can also be termed as blood vessel disease. So elevated blood pressure or hypertension is in fact a mechanical disruption to your endothelium. And what is the endothelium? It simply means the lining of your blood vessels that includes your arteries, veins, capillaries, and the lymphatic system. So your endothelium has many functions that support blood flow and keep the body stable. And that includes controlling blood fluidity, regulating inflammation, and controlling contraction and relaxation of the blood vessels. Okay, and that being said, I would also like to mention that smoking is a chemical disruption to the endothelium as well. Now, because your blood pressure varies through the day, your doctor will not diagnose you hypertension on the basis of one single reading. Instead, he or she would want to confirm the measurement on at least 2 occasions at the clinic, or have you measured your own blood pressure yourself with a home monitor first? Now, that being said, the bigger issue now is how many people are actually walking around and haven't been to the doctor in the past 5 years, who don't know what their blood pressure reading is because presumably they're not checking it on their own, and hence obviously they're not taking any medication. This can turn out to be a silent epidemic because there are no symptoms to high blood pressure. Now, the blood pressure clearly goes up with age as well, okay, and that's because of increased vascular stiffness. Yeah. So it's even more important that as we get older, we really need to keep watch on our numbers. And why do we need to monitor our own blood pressure then? So high blood pressure, well, as I explained, can be a silent killer because it often goes undetected, especially for those who are not as diligent in going for annual checkups. High blood pressure is also known as a silent killer, as I mentioned earlier, as it often goes undetected until a serious health complication such as heart attack or stroke happens. So regular blood pressure monitoring is probably the only way to detect high blood pressure. Home monitoring is useful for individuals on blood pressure medication too, as keeping a record of your own blood pressure readings provides you with a clear overview of changes in the blood pressure over time, and could also signal whether treatment for high blood pressure is working or not. Other than the risk for cardiovascular disease, high blood pressure also has effects on the brain and other organs. Yes, it does. And the 3 other organs that are very susceptible to high blood pressure are the heart, the brain, and the kidney. Let's talk about the kidney first. There is a very high incidence and prevalence of end-stage renal disease in patients with hypertension. Now, we need to know that our kidneys are not very large organs. They weigh just about 1 to 2% of your total body weight, averaging about just 108 grams to 137 grams, and yet they are receiving 20 to 25% of your cardiac output with each pump of the heart. So think about what that organ has to accommodate, and hence they are highly susceptible to elevated blood pressure. People with hypertension tend to have faster rates of decline in the renal function than age-adjusted people with normal blood pressure, and this results in a stark decrease in the GFR readings. Diabetes is also an enormous insult to the kidneys, though for a different reason which we are not going into that today. However, we need to consider the fact that often high blood pressure and elevated glucose go hand in hand. And there are 2 risk factors which I mentioned earlier in this part. Did I mention risk factors? I did, right? Okay. However, we need to consider the fact that often high blood pressure and elevated glucose go hand in hand. And they are 2 of the risk factors which I mentioned earlier at the start of this podcast. So I need to stress here that this is an epidemic that's not getting enough attention. That is, the decline in GFR can be a result of the double whammy of high blood glucose with high blood pressure. Next, let's look at the brain. There was another trial that's similar to the SPRINT trial conducted, which was called the SPRINT Mind trial. Now, basically, it was a study that looked at the impact of intensive blood pressure lowering in the state of dementia. In the same cohort, a little over 9,000 subjects, the absolute risk reduction of dementia was 0.6%, and that is pretty significant. A relative risk reduction of about 16% and is consistent with the observational data and other long-term prospective studies that we have seen. And there is really no data that speaks in the opposite direction. So if you would like to take care of your heart, your brain, and your kidneys, you need to lower your blood pressure. Are there any symptoms of high blood pressure? Can you tell? No, you will only know when you measure your blood pressure. There are really no symptoms for elevated blood pressure. Now, when to take your blood pressure? Singapore Heart Foundation recommends that individuals should start checking their blood pressure from as young as 18 years old. But for those over the age of 40, should have their blood pressure measured on a regular basis. What are the best times then to take blood pressure readings? The optimum time to accurately measure blood pressure is in the mornings, about 10 to 15 minutes from the time you wake up. The blood pressure has a 24-hour circadian pattern. In the morning, the blood pressure is slightly higher than the evening, and when you sleep, the blood pressure drops by 10 to 15%, and it rises again in 1 to 2 hours before you wake up. Then, how do you measure your readings accurately? Now, the best way is to just follow certain guidelines which I'll be giving you right now on how to ensure your readings are as accurate as possible. So first and foremost, the best position to take your blood pressure is seated in a chair with your feet on the floor and your arm supported so your elbow is at the heart level. And you should remain in this position throughout the entire measurement. Avoid drinking any caffeinated beverage or smoke during 30 minutes before the test, and do sit quietly for at least 5 minutes before the test begins. With the cuff on your bare arm, sit in upright position. And make sure the bottom of the cuff is directly above the bend of the elbow. The inflatable part of the cuff should completely cover at least 80% of your upper arm, and the cuff should be on a bare skin, not over a shirt. If you're wearing a long sleeve shirt, don't be lazy, just change into a sleeveless and then retake your test. Cuffs that are too small in size can also artificially raise your blood pressure reading. Some medication, including over-the-counter pain relievers, such as aspirin, and common decongestants such as nasal sprays, can elevate blood pressure as well. Alcohol, caffeine, salt intake, and stress can raise your readings too. Next, make sure you don't talk during the measurement or even looking at your cell phone. It's just for less than a minute. Next, don't take blood pressure with a full bladder. Have your blood pressure measured twice with a brief break in between. If the readings are different by 5 points or more, have it done a third time. And you can check your blood pressure at the same time each day, such as twice in the morning and twice in the evening for a week. And you can share the results with your doctor. The readings can fluctuate a lot within the day, so you need not to worry about a single high reading. But if the average over the entire week is high, you should take it to your doctor. Otherwise, just continue practicing your heart-healthy behaviors and check your blood pressure regularly. Now, is there a difference between the left and the right arm? The Singapore Heart Foundation recommends to measure with the left arm because the heart is situated slightly to the left of the central midline of the chest. But that being said, if you can, it is a good idea to have your blood pressure measured in both arms at least once, since the reading in one arm, usually the right, may be higher than the one on the left. In general, the arm-to-arm difference in systolic blood pressure is 5 points or less. If the difference is persistently greater than 10 points between two arms, you should let your doctor know about it because it could be a sign that you have more than expected arterial plaque buildup. Now that you know why it is important to monitor your blood pressure, and you would like to buy a blood pressure monitor yourself from the pharmacy and measure at home, Then what is it you need to do to have the most accurate readings? What do you do if you have elevated blood pressure? And what does it mean if you have low blood pressure readings? All these I will cover in the next upcoming episode. Meantime, I will attach all the relevant links and reading materials in the description box on my YouTube channel so you can check it out there. If you have not subscribed yet, please subscribe to my podcast and my YouTube channel because number one, it is free, and two, you will get to learn so much about your own health, about fitness, nutrition, and many more. Thanks for listening today, and bye!